Mesdames, Mesdemoiselles, Messieurs, bonjour. Vous êtes sur Live Doctor, la chaîne d'information médicale. Amis téléspectateurs, amis auditeurs, nous avons le plaisir, l'honneur de recevoir aujourd'hui le professeur Roberto Lang. Professor Roberto Lang, you have an impressive bio. And if you permit. Roberto Lang, Professor of Medicine, Director of Non-Invasive Cardiac Imaging Laboratory. He's an international renowned cardiologist and specialist in echocardiography, the study of heart function using sound waves. Professor Lang used his vast knowledge of cardiac imaging technique to evaluate patients with a wide variety of heart conditions, including heart failure and valve disease. Dr. Lang was a pioneer in the development of three-dimensional echocardiography, a state-of-the-art method to observe heart function. He is a past president of the American Society of Echocardiography. You are a renowned cardiologist and you are the pioneer of the cardiac ultrasonic 3D. I think you are the pop of this specialty. My first question is, how is born this new science, the science of echocardiography?
So it's first of all, thank you very much for having me. Let me tell you a little bit about echocardiography. Echocardiography was born approximately 70 years ago. It happened in Sweden, in the city of Lund, and Dr. Edler, he actually got inspired with the use of submarines in the Second World War, with the use of sonars. So he had this idea of using sonars, and together with Dr. Hertz, they actually invented the first ultrasound machine. And this has created a revolution because in all of these years, this is the test that is more frequently used in the whole world to diagnose heart disease. Another interesting story is that Dr. Edler, he never won the Nobel Prize. And the story is that if you come from Sweden, you have to do like a double contribution to get the Nobel Prize, because for this probably should have merited him getting a Nobel Prize.
What are physical principles of echocardiography?
So let me explain to you a little bit the physics of ultrasound in a way that we can all understand. I think we all understand what an echo is. You know, when you are and you shout and you hear, if there is a big mountain, you hear an echo back. So this is the same principle of ultrasound. You have a little transducer, which is like a pencil that you put on the chest, and this transducer will send sound waves. And these sound waves will hit different types of structures, and the echoes will come back. Then these echoes have different intensities, and they're transformed into an image. And the beauty of it is that you can see the heart pumping, despite the fact that you did not do anything invasive. You just put a pencil on your chest that sends sound waves, and you can see immediately the heart as it is pumping with the blood going through all the different parts of the heart.
That is the physical principle of this.
That is the physical principle, is the same as a sonar in ultrasound, or what everybody would understand is what is an echocardiogram. An echo when you shout and you get an echo back, it's exactly the same principle.
How did you get the idea to use 3D?
Well, I got interested in cardiac ultrasound many, many years ago. I actually had the opportunity to do training in Israel about maybe 35 years ago. And I had a professor here in Kfar Saba who was starting to work with ultrasound. And that got very, very interesting. And from that moment on, I knew that I was going to do cardiac ultrasound. Now, how did I get into 3D? This is a very long story. 3D echocardiography is already around maybe 25 years. But around 25 years ago, it was very complicated to get an ultrasound image. So to get an image, you would need to get a transducer, which is this pencil that sends sound waves, connected to a computer. And then you would have to obtain images from many different directions. And then you would put all of these images into a computer. You waited many hours and you got initially a 3D picture that did not move. Then with the advancements and over the last 10 or 12 years, mostly working with a company from Holland and the United States called Philips, they developed a transducer that was magical because you could send sound waves and you would see in real time, at the same time, the heart beating in 3 dimensions on the screen. So that changed everything because in medicine, it's not very practical to obtain images, then wait for hours till you get a result. You want to get these results immediately so that you can do something for the patient. So this is how this developed. Such a development is always usually the idea between industry and between scientists. And when they work together, it is a very powerful combination.
Professor Lang, in what this revolution changed the practice of cardiologists?
Well, that is actually a very good question. I think that the ability for doctors to see the heart, how it really looks in the chest, has changed many things. For example, we can show the heart to a cardiac surgeon, and he or she can look at the heart in a manner that is very similar to the one that they will open once they open the chest and they see the heart. So that allows them to truly understand what type of operation they need to do. I think it is to answer this question in a simple way, I think it is the best way that you can show somebody the heart exactly how it looks and in a manner similar to what a surgeon will do. Another very important use of 3D ultrasound, you know that now in cardiology, you have a big revolution of interventional cardiologists. And people are putting valves through the veins into the heart. People are closing holes in the heart. With 3D ultrasound, we can guide the interventional cardiologist and tell him exactly what is the best way to change, to put a valve or to close a hole. We can guide those interventions. So in my daily life, I spend many hours either in the operating room or in the cardiac catheterization laboratory, working with surgeons, guiding them what is the best procedure that they can do on behalf of a patient.
Really, it's a revolution.
It is. I mean, it is a big revolution because it's a different way of thinking. Before ultrasound, you could only get certain pictures of the heart, and you had to put all these pictures in the heart in your brain and try and think how the heart looks in 3 dimensions. Now you can really look at the heart in 3 dimensions. You can cut it in any direction. You can move it. You can twist it. And I think it is a complete revolution on how you can really help patients by making a more accurate diagnosis.
And you have now complete view of the heart.
You have now a complete view of the heart, of all of the chambers of the heart. You can actually cut it. You can use what we call color Doppler to look at the blood flow in the heart to see if a valve is stenotic or if a valve is insufficient. And this information, I think one of the beauties is that it's very easy to interpret. A surgeon that sees that understands what the problem is. So I think it is one of the biggest revolutions in cardiology for sure over the last 10 years.
This technique can avoid opening the heart?
Well, that is, I don't think you still need to open the heart in order to do an operation. But what it helps you is you know exactly what type of operation you want to do. So, another thing that people are doing now is something that is called 3D printing. So people take the ultrasound and they can print the ultrasound findings and you can create a model of the heart. So you can give a surgeon this model of the heart and he or she can really think what type of operation they want to do. I don't think you can avoid, but you can make an operation be quicker, more effective, and definitely in the cath lab, there are many procedures that are being done that without the use of 3D ultrasound, the people in the cath lab would not be able to do this, or it would take hours and hours in order to complete this.
Professor Lang, how do the consultation 3D ultrasound?
Well, we, in our hospital, we do approximately 100 tests of cardiac ultrasound every day. We have about 14 people who acquire these images. In English, we call these people sonographers. And each of these machines have the capability of acquiring both two-dimensional and three-dimensional imaging, because there are two different ways in which you can get these images. You can get these images from the surface, from the thorax, or you can put a camera in a tube that you make people swallow. So you see the heart from behind and you get very clear images. That is called transesophageal echo. So we acquire these images. 3D ultrasound is also excellent to quantify the pumping ability of the heart. It's much more accurate than two-dimensional echo. So we acquire these images in every patient and we analyze them. So we are a little bit more advanced, but this is penetrating and I think it's being used all over the world.
Is the 3D ultrasound allows to make new diagnoses?
Well, that is a good question. There are times in which you can truly make, I always say that if somebody is excellent at two-dimensional echocardiography, it is difficult for three-dimensional echocardiography to make a new diagnosis. But three-dimensional echo, because you're seeing the entire heart, makes it much easier to make a diagnosis. Not only that you can make a diagnosis, but you can look at the exact location of where the problem is. Not only you can look at the location, but you can look also at the relationship of this lesion with the adjacent structures. So in reality, you don't probably make a new diagnosis, but when you make a diagnosis, you learn much more about it.
Can you tell us the importance of 3D ultrasound in the diagnostic, in the treatment of valvular heart failure and international cardiology and heart failure?
Okay, so
three domains.
Three different diagnoses. So let's start with heart failure. Heart failure is a very common diagnosis, and this is a diagnosis in which the heart usually fails to pump very strongly. So three-dimensional echocardiography is excellent to measure the pumping ability of the heart. So we can know how the heart is pumping, and we can follow it over time and see if there are any changes. We can look at the effect of different medications and see if that's improving the pumping ability of the heart, etc. So, we have a lot of patients that have heart transplantation or that have artificial hearts. In English, that is called left ventricular assist devices. And with 3D echo, we can really measure exactly what's happening with the heart. So that is a very accurate type of diagnosis. In cardiology now, people are trying to study very much what happens to the patients that have cancer and receive different types of medication. So 3D echo is also extremely useful in order to follow and measure the pumping ability of your heart. Interventional cardiology, we already talked about. I think that's something that we use every day and is very popular. It's used around the world. There are many interventional cardiology procedures that cannot be done if you don't do them together with a cardiac ultrasound. And regarding coronary artery disease, I would say that, again, in coronary artery disease, it's very important to know how the heart is pumping. There are many different types of medications. We're looking at certain regions of the heart that are not pumping very strongly. And with 3D echo, we can follow them very much. So we almost do it routinely. We are lucky because these machines are expensive. We are lucky we have a lot of machines. So because in many hospitals you have just maybe one or two machines that do this. So we are lucky we have many of these machines. So we use it almost in every patient, and we do a combination of 2-dimensional and 3-dimensional echocardiography. 3-dimensional echocardiography is extremely useful in valvular heart disease. And this is probably one of the best uses of 3-dimensional echo, particularly the visualization of the mitral valve, where a lot of surgeries are being performed. The mitral valve can be visualized from the left atrium, and you can go also and look at the mitral valve from the left ventricle. And I think that this is one of the uses in which 3-dimensional echo is extremely useful. We talked a little bit about interventional cardiology. Many times when you have artificial prosthetic valves and you can see certain problems with that valve, and 3-dimensional echo is extremely useful in making that particular diagnosis.
Did this technique modify the outcome?
Yes, well, 3-dimensional echo has modified outcomes. This is difficult to test in a particular study. But for mitral valve repair, which is a very common type of surgery performed on a mitral valve that has degenerative changes like prolapse or a flail mitral valve, 3-dimensional echo has had a particularly implication on outcomes. 3-dimensional echo tells you some of these operations are very difficult to do. So you need to go to a surgeon that has a lot of experience doing this type of an operation. And 3-dimensional echo allows you to determine which would be the best surgeon to do this operation. So I think it has a major impact in outcomes regarding the ability to work with interventionalists. I think that this combination of an invasive cardiologist and an ultrasound doctor is a very powerful combination that allows people to know where to put their catheters to do the different types of interventions.
Professeur Lang, vous êtes cardiologue, vous êtes un cardiologue renommé. Vous êtes, je l'ai dit, le pape de l'échographie en 3D, l'échographie cardiaque en 3D. Vous recevez des patients tous les jours. quelle est la spécialité, quelle est la spécificité de ces patients qui viennent vous voir et pourquoi viennent-ils vous voir?
Well, I work at the University of Chicago, which is a big university with a lot of cardiologists. So everybody has a subspecialty of a subspecialty. And because I do cardiac ultrasound, the two types of patients that I more frequently take care of are predominantly patients with valvular heart disease, because there is a very nice affinity with ultrasound. And secondly, patients with heart failure. Though when patients with heart failure get very sick, the heart failure people will take care of them because they will need transplants or LVADs or other things. But I would say that predominantly the patients that I see are patients with valvular heart disease. And what does that mean in the United States? Because valvular heart disease is very different according to the place where you practice. In the United States, we don't have any rheumatic heart disease. So if you think about valvular heart disease, you think about two things. You think about degenerative mitral valve disease. You think about functional mitral regurgitation, which is the mitral regurgitation that occurs after a myocardial infarction. And thirdly is the disease that we see all around the world, which is the most common one, which is aortic stenosis, for which in all the countries in the world, they are putting now these artificial valves, TAVI valves, in the aortic position. And that is another big revolution in cardiology.
Professeur Lang, vous participez actuellement à un très grand congrès de cardiologie internationale. J'ai deux questions. La première, quelle est votre contribution? Quelle va être votre contribution à ce congrès? Car je sais que vous devez prendre la parole. Et la deuxième question, quelles sont les avancées en matière de cardiologie qui vont être dévoilées lors de ce congrès de cardiologie?
Okay, so let me answer first what I will be talking about. I am very lucky I get to go to many countries to talk about cardiac ultrasound and particularly three-dimensional echocardiography. And I will be talking about the use of three-dimensional echocardiography to visualize the mitral valve and what type of impact the three-dimensional echo has on the visualization of the mitral valve.
You are really the Pope of the 3D.
Yeah, I'm not only the Pope, but now I'm always very happy that the Pope is from Argentina. So have it. But the other thing of what I think in this international meeting, what we will be learning about is the use of these percutaneous replacements of the aortic valve. And interestingly, this is a time in which we see a lot of new advances in medication. This is the first time in many, many years that we see advances in the use of new medications for the treatment of heart failure. So this is, in big picture, I think, what will be the big advancements that are going to come from this meeting.
Selon vous, y a-t-il des différences d'approche, des différences d'utilisation de la technologie de l'échographie en 3D?
Well, I had the opportunity to be this year in the Cardiology French Congress in Paris. And the advancements that you see in Europe, meaning the difference between the United States and Europe is minimal. And Europe is advancing tremendously. American medicine is in a way socializing, so advancements are going a little bit slower. I think that Europe and the United States in the next couple of years will be virtually indistinguishable. And you can see beautiful studies of three-dimensional echocardiography coming out of Paris.
Professeur Lang, vous êtes maintenant le praticien de l'échographie 3D. Vous maîtrisez cette technique, vous l'avez fait connaître à tous vos confrères. Pensez-vous que cette technique va encore évoluer? Pensez-vous qu'il y a des perspectives d'avenir dans ce domaine?
Well, that's an interesting question. As I told you at the beginning of the interview, ultrasound started 65 years ago. And every time that a new development comes, you say, well, maybe this is it. There's nothing more that is going to happen. And if you take it over the years, every couple of years, there is a new breakthrough. So, in echocardiography, you see first it was M mode, then we had two-dimensional echo, then we had the Doppler, and then we had color Doppler, and then we had three-dimensional echocardiography. And now you're seeing a lot of applications for three-dimensional echocardiography. And I don't know exactly what will be the new frontier. The new frontier is probably going to be the miniaturization of echo machines that will become very small, and doctors will be able to use them instead of a stethoscope to see what's happening with your heart. And
It's amazing,
amazing. And I think that, the imagination of a human being has no limits. So I am sure that in the next couple of years, we'll see a whole new set of advancements.
Professor Lang, for myself and on behalf of all the team of Live Doctor, and also on behalf of all listeners, thank you. Thank you sincerely for your contribution. It's a great honor for us. Thank you.
Thank you very much. A great honor for me. Merci beaucoup.